Hi, everyone. My name is Rowena Eng. I'm here to talk about sustainability in the healthcare sector, primarily from the perspective of working as a sustainability professional within different hospitals. My background is mixed in like marine biology, biomedical lab research, and clinical research. And I received my master's in environmental science and management after a few years out of my undergrad. And after I got my master's, I worked for 3 years as sustainability coordinator at UC San Francisco. And then most recently, I was at Memorial Sloan Kettering Cancer Center in New York. And I hope by the end of my overview, you'll get a better understanding of how climate is connected to our health and the many opportunities to get involved, no matter what your background is. From a healthcare perspective, there's a pretty compelling argument that we need to do what we can to reduce the impact of climate change, and that's because climate change can negatively impact human health in many ways. So what you see here is an infographic from the CDC, and if you start from the inner circle, you have the immediate consequences of climate change and global warming. So this includes some of the things that Amy spoke about before. You have rising sea levels, you have extreme weather events, rising global temperatures, and increasing carbon dioxide levels in our atmosphere. So now as you move from the inner to the outer parts of the circle, you can see how these consequences of climate change impact our health. For example, if you look on the right side, the rising temperatures lead to extreme heat, and that can cause heat-related illnesses and can even lead to heat-related premature deaths. Rising temperatures can also lead to stronger and more frequent weather events like hurricanes, which can devastate entire communities like we've been seeing in the past few years in Puerto Rico and other places. And so when these events happen, they can be very catastrophic and leave many people injured, homeless, and there are even fatalities associated. On the bottom left, another example is the higher carbon dioxide levels in our atmosphere can disrupt the balance of very fragile natural ecosystems and then lead to environmental degradation. So how this can impact health is that there might be low income communities that rely on the environment as their livelihoods, like people who rely on plots of land for farming. If their environment is degraded to the point where it's no longer usable, then they need to migrate, which can cause civil conflicts because now there are more people moving to a space and more people trying to share the same limited natural resources. So from this picture here, we can see that addressing sustainability and climate change goes hand in hand with the mission of healthcare. So if you're working in a hospital, sustainability efforts are often broken down around these 10 focus areas. So I'll talk about a few and how they kind of like play a role in a hospital. So green buildings, that relates to the design, construction, or renovation of the physical buildings where you have maybe ambulatory care, clinical space, research space, even administrative space. And a lot of things go into that. So for example, you want to design buildings using healthier and safer building materials. You want to design buildings that they support the wellness and health of your patients, your staff, and visitors. And you want to make sure that they provide proper air ventilation, but that they're also energy efficient. One thing that is very niche to healthcare is greening the OR or greening the operating room. As you can imagine, when you have like all these high turnover of patients and surgeries and OR cases, you use a lot of disposable materials. It creates a lot of waste and use a lot of energy to make sure that there's proper ventilation to reduce the risk of infection. So there's a specific focus area just for the operating room setting because it is very a specialized area where healthcare professionals work. And then waste, I think, the average person might be exposed to your usual like trash, recycling, maybe compost, now that it's rolling out in New York City finally. But in the healthcare setting, there are probably 20 different waste streams. If you think about all the regulated medical waste, the types of um, pharmaceutical waste, and then electronic waste. So there's a lot of different waste streams that we track and have to report. And we work with the appropriate teams to set goals on how to reduce the amount of waste generated and also the amount of waste that we divert from landfill. Some other areas are energy and climate, as I mentioned before. This goes hand in hand with the healthcare mission, and a lot of the operations and daily operations across a hospital setting use a lot of energy because oftentimes you have things that are running 24/7, and they are also just very energy intensive. For sustainable food, we would work with the food and nutrition team on procuring local and healthy and sustainable food to serve in the cafeteria for patients. And then things like safer chemicals. So even things like your IV bags could have harmful chemicals like polyvinyl chloride, which is like a neuroendocrine disruptor. And there are efforts to try and phase that out. They've mostly been phased out in the NICU, which is like the neonatal intensive care, because they are the most vulnerable to the impacts of these chemicals. But there is a challenge in phasing them out entirely because there are very few cost-efficient alternatives out there. So there are many challenges in healthcare for sure, but these are some things that we work on. In the healthcare industry, you have private and public hospitals, you have corporations, you have insurance companies, you have medical device manufacturers, and you have suppliers. And so, all of that is involved in healthcare. But here is an example of how a sustainability program might be structured within a hospital setting. And the good thing is, as you can see here, like everyone can get involved, even if you don't have the official sustainability in your position title. So most sustainability teams are very small, and like obviously we don't have all the expertise in supply chain and green buildings and facilities. So the way we conduct our work is through a network of committees and staff from other departments. So in this example, you see that we have the overarching sustainability steering committee, which usually, the highest level of governance, and it's made up of department leaders. Sometimes it's like director level or above, from departments like the design and construction team, supply chain team, the food services, facilities, nursing team, mental health and safety or environmental services, EHMS, marketing communications. It's a highly cross-functional collaboration in sustainability. And then at the next level down, you might also see subcommittees created for more specific and unique work settings, like the operating room, as I mentioned before. In the hospitals that I've worked at, we do have a breathing to OR committee made up of staff representatives from the nursing department, anesthesiologists, supply chain, the peri-op team, environmental services, and infection control. If your hospital also has like a research arm, like a research institution, then you might have a green labs committee. So there's also a very fast growing field in sustainable research labs. Because they also, in the same way as an operating room, they use very highly energy intensive equipment that run 24/7. And so in that committee, you also get representatives from everyone who partakes in that area. So environmental health and safety, the lab facilities team, the researchers themselves, the administrators, environmental services, and together we can all work together to really drive sustainability programs for that particular area. And so if you see on the right side, as I mentioned before, like all of this network is supported by the sustainability team. And so the way we work hand in hand is that the sustainability team will provide the environmental expertise, project management, the research best practices, while the committee members can offer more of the on-the-ground operational knowledge from their specific functional area. So for example, if we wanted to, drive some initiatives in sustainable food, for example, we, we're not the experts in how the cafeteria operates in the hospital, but then we work with our representatives from food and nutrition, and we tell them that, this is what the industry is doing. We want to move towards sustainable food, and we help educate them. And then they are the ones who work in the cafeteria every day, so they know how to integrate these sustainability concepts and practices into the everyday cafeteria operations. And that's just one example. So, so yeah, it's a highly collaborative and multi-department effort. And so sustainability really does require a lot of managing through different departments and cross-functional teams.
What are some of the things that people can do to promote sustainability?
Yeah, that sounds good. So one thing that everyone can do is to reduce your food waste, and this also helps you save your money. So 40% of all food in America is never eaten, and like the sad reality is that we actually have a choice to waste food, whereas lower income countries like do it by accident because maybe they don't have the infrastructure for efficient transportation of their food or efficient storage and refrigeration of food. But in America, a lot of time food is wasted because we look at an apple and we see that it's bruised and then we just reject it. And the reason why it's very impactful is because there's a lot of land and water and energy that is used to grow the crop and the livestock that we eat. So the land that is used to grow livestock, for example, this is vast amounts of land that gets deforested, and this reduces the opportunity for that land to actually take in carbon if you are removing the trees to clear the land for cattle grazing, for example. And then there's a lot of energy used in the processing of our food, the packaging, and the transportation. Like food travels very long distances before it's in front of us. And perishable food especially requires a lot of refrigeration, which is very energy intensive. So there's just a lot of resources used along the way from where it's grown to the point where we consume it. And even when you dispose of leftover food, it causes additional and unnecessary greenhouse gases, because when you throw out food into the landfill, there's like the way that it decays in the landfill creates methane, which is a very strong greenhouse gas. It's even stronger than carbon dioxide. So one way to kind of mitigate that is to actually compost your leftover food, but really the most impactful way is to reduce. So, the hierarchy is always to reduce, reuse, and recycle. So the recycling or composting is always the last resort. So some tips on how you can reduce your food is really to be intentional with your meals and your food shopping. So buy only what you need. So you want to plan your meals, make a shopping list, and stick to it, and just try to avoid those impulse buys. You might want to try buying local so that the food doesn't travel as long of a distance to get to you. And also, if you buy local, the food will be fresher, be more nutritious, and you'll be supporting local farmers. Another good way is to learn the proper food storage technique to prevent premature spoilage. So just learning how things should be stored to maximize their lifespan. And then understanding the difference between the so-called expiration dates or best before dates, because a lot of times, some of you might already do this, but you can just give it like a sniff test and for like expired milk, and you see that it's actually still okay to drink. And I say this with caution, of course, like it comes with kind of practice on knowing what food you can extend past the specified date and which food should not be extended. Eating less red meat is also a huge contribution you can make to reduce climate change. So red meat is like the most inefficient source of protein, meaning that if you compare a gram of plant-based protein versus a gram of red meat protein, the environmental damage from the red meat is much higher. And I know that, we love our pork, we love our beef, but if you have the option to, it's much better for the environment to just choose chicken over, lamb or beef. and that can make a huge environmental impact. If you have food leftovers, freeze them instead of just throwing it out. Get creative with your food scraps. You can save your food scraps and make vegetable broth. And then also just taking the time to learn where your food comes from and appreciate it, because it does have to travel a long distance. And most importantly, you have these farm laborers who work very long hours in the sun with probably very low wages to grow the food and to harvest it so that it gets shipped to your local grocery store. And then if you do have leftover food that's unavoidable, you can donate it if there are places that accept it. And then as the last resort, you should compost it. So if you have leftover food and you send it to the compost, it decays in the way that produces less methane, and it actually creates a very fertile soil that can be used to grow more plants that will take in carbon from the atmosphere. So it has a lot of benefits to composting versus sending something to landfill. And that's my tip for contribution to sustainability.
Great, thank you for sharing those very important tips.
Thanks. Yeah, so speaking of ways that you can contribute to sustainability in your personal life, one of the feedback that I get, when I work with staff members across hospitals, that they want to make a difference and they want to do something to be more sustainable, but they don't know where to start because, as we've touched on throughout this presentation, sustainability is very broad and there are many things that a person can do. So I do acknowledge that it can be very overwhelming and it's hard to find out where to start. So the great thing about this Earth Month Eco Challenge is that it breaks down things that you can do in very simple, digestible steps, and also provides a lot of learning resources. And you can do it at your own pace, but this adds like a fun competition aspect to it. So this is a global challenge hosted on a website on ecochallenge.org. You can make an Eco Challenge account and join the DFS team that we have, and then you can select what actions you take. They have like a list of predetermined actions, so you can choose which ones that you're most interested in, and then you can like mark them as complete on a daily basis or as a one-time basis, and then you earn points. So it's just a fun way to learn, and it's based on the UN Sustainable Development Goals. So it is a good introduction to how you can make a difference in your personal life. And it runs through the end of April.
My question is that I know you have been doing this for a number of years in a number of hospitals, but is it happening in most hospitals in the US, in Western country, in the world? Is it becoming a growing bigger and bigger practice, focus for healthcare industry to focus on sustainability? Is it a growing thing?
Yes, I would say it's been gaining traction over the past maybe 15 years. I'm sure, this was something I never thought was actually a thing until I accidentally discovered it during an internship when I was doing my master's in environmental management. But I'm glad that there is space for it, because I did want to work in a job that kind of combines, my passion for health and for the environment. But yes, a lot of hospitals are taking action. Like, they do acknowledge that, their whole purpose and mission is to advance health and to serve their communities. And if they are seen as, using harmful chemicals, incorrectly disposing of hazardous waste, or, contributing to local air pollution by combusting fossil fuels on site, it just looks very, bad for them. Especially private healthcare organizations also have the investor demands too. So it is definitely growing.
What about internationally, globally?
Yes, there's actually a nonprofit called Healthcare Without Harm. And so it's an international organization that connects healthcare leaders from different organizations, private and public. And what they do is they conduct cohort meetings to kind of get the best practices and to share really the best practices. So as I said before, sustainability has to be very collaborative because hospitals are probably all under-resourced. So the only way to like get things done is to really work with other hospitals, share ideas. If something is being done at one hospital and it was successful, then you want to write that into a case study and then share it so that other hospitals can try to replicate it. So Healthcare Without Harm does have a global network of participating hospital members. And within the United States, we also have a nonprofit called Practice Green Health, and they're actually the ones that lead those 10 sustainability focus areas. And what they do every year is that they release an application. It's called the Environmental Excellence Awards. And it's actually like a 900 question application where you have to like submit numbers on your waste and your water and your sustainable food purchases. And then they will score you based on your responses and compare you to other hospitals of a similar size and type. So that's called benchmarking. So benchmarking is very useful because you can compare how your organization is performing in these environmental areas compared to other organizations of the same size, of the similar location, or the same type. And then you can kind of see like, okay, like, and then you can also perform something called a gap analysis. So like, let's say a hospital in your region of a similar size is able to divert 50% of their waste from going to landfill, but you are only doing 25%. Well, like how can you reach the 50%? You know that another hospital is able to do it. So then you work with the other hospital and try to learn how they did it, and then you try to bring it to your organization and replicate it. I did want to respond to Daniel Lin, your tips and suggestions for someone without a science background. So sustainability, I think Amy touched on this before, sustainability is so broad that I think people can come from so many backgrounds and be able to work in sustainability. And it does depend on what aspect of sustainability you want to work in. If you're like me and you work in sustainability within like an organization, then you also need a lot of soft skills like project management, stakeholder engagement, change management skills. It's about getting people from different groups and from different departments together and like helping them to create change. And the way you do so is, through demonstration of the benefits, whether it's financial benefits, it's benefits to patient care, or there are many types of like quantifiable and non-quantifiable benefits. And finance has become especially important in sustainability because of what we talked about, how investors are demanding ESG metrics. And so they need people to be able to tie sustainability performance to their financial accounting to show, how it's impacting their bottom line. So finance is a, I guess, non-science background that can be very useful for sustainability.
I have a question about sustainability in the medical field. It was definitely a pretty new concept to me. When you think of medicine, you think of like medical waste and, chemicals and medicines that, are maybe helpful to the patient, but like who knows what they can do to the environment. I was wondering if you could share with us something specific that you worked on, maybe that where a alternative solution was proposed and a hospital actually went ahead and started using this more renewable or more green kind of material or of some sort, if that makes sense.
So there are a lot of good examples. I think the top one that comes to mind that I think everyone should start getting familiar with is reprocessing medical devices. It's a similar concept to refurbishing electronics. So when you have like a surgery or operation, or you often have these single-use disposable instruments and surgical equipment that you use once in the operating case, and then you throw it away. Now, there are many companies that will refurbish or reprocess those devices. And it's only for select devices. And And so you have to work with the OR staff and the team and everyone involved with the OR cases to educate them on what items are eligible, train them on, you have to have bins set up so that they know that to put those eligible devices into the bins after each OR case. And then you have the vendor come in and collect your processing bins. They take it back to company and they will reprocess them and pretty much bring it back to original manufacturing standards, and it actually exceeds FDA requirements. So it's very safe. In the beginning, a lot of doctors and clinicians were very hesitant to actually buy reprocessed devices, even though they were heavily discounted, because you're not using raw materials to manufacture a completely new device. But then I think after some hospitals start doing it and they start showing the savings, you get savings from reducing the amount of waste because you're not sending those devices to landfill, you're actually, sending it back to the reprocessing vendor. They turn it into a new device that you can reuse. And when you buy it back from them, you get a huge discount. So then there are savings from just those discounts as well. And then, so it's good for your budget, it's good for the environment. And I think after people start seeing the financial savings and knowing that those savings can then be diverted to improving patient care in other areas, they're like, okay, like this business case makes sense. So a lot of hospitals have adopted what they call like single-use device for processing. And there are many companies that are kind of like sprouting because they know there's so much value in taking those used surgical devices and reprocessing them and then reselling them because they know there is a demand to reduce waste in the hospital setting. Another interesting thing that has come up is one of the anesthetic gases, desflurane, has the highest global warming potential. It's like, I won't get into the nitty-gritty details of the global warming potential, but like it's a very potent greenhouse gas. And so many hospitals have now phased it out and they're using other anesthetic gases like nitrous oxide that have a lower global warming potential instead. So that obviously involves a lot of collaboration with the anesthesiologist because as a sustainability professional, I can't just go in there and be like, hey, like you need to stop using desflurane. Like I'm not the medical expert, but then I just have to start talking to them and showing them like, there's some studies out there that say like desflurane is very bad for the environment. But then you have all these alternative anesthetic gases that are equally effective and don't harm the environment as much. And then you present them the information in a way that, isn't like crossing their boundaries. And some doctors are actually very environmentally conscious and they will help you champion and lead that change in their anesthesiology administration practices. So a lot of hospitals have either completely phased out or have greatly reduced the amount of desflurane that they use on their patients. And that creates a huge impact on reducing their greenhouse gas emissions. Thanks everyone, great questions.